All right, hi everybody. I've got Rachel with me. She's one of our techs here at Team Rehab Auburn Hills. This is our demo for the blood flow restriction unit. First thing we do is we make sure we screen, all our patients for the contraindications, like on the slide in the PowerPoint. Which we do for every patient. But the PowerPoint basically says, if the patient's fit for surgery due to that compression from the surgical grade tourniquet, for an hour or so or however long the surgery is, typically they're going to be just fine to have an intermittent blood flow restriction treatment. So I'm going to kind of do a demo of what we usually go through. So to turn the unit on, each patient does get their own limb protection sleeve, which we will use, or if the patient has yoga pants on or a tight fitting pant, it's not a problem. So I'm going to have Rachel lay down on her back. Every time we use the blood flow restriction, it does its own internal Doppler for every single patient, every single time, because that pressure may change, that personalized limb occlusion pressure may change. So putting this on the patient, typically you want it as high up on the thigh just to avoid any peripheral nerve compression. So as high up on the thigh as the patient can tolerate, just like that. And then go ahead, bring your legs straight. So every time we go through this, the patient lays as still as possible to make sure that we get that true limb occlusion pressure. And that's what the real-time Doppler is going to sense. The blood flow unit has a couple of different protocols, one for upper and for lower extremity, based on what you want to do, endurance protocols or strengthening protocols. So I'm putting it on the lower limb strengthening protocol, and then I'm going to click PTP, so personalized tourniquet pressure. So right now the blood flow unit is going through its sensing of trying to figure out where her limb occlusion pressure is. It's getting a sense for her blood flow in her artery right now. So this usually takes about 30 seconds or so, trying to find her full occlusion. And like we've talked about in the basically the protocols, somewhere between 50 and 80% of full occlusion is what we have the patients work out at, and that shows to have those maximal strength gains. Good. So her limb occlusion pressure is 197, so 197 millimeters of mercury. So with that, I'm going to change it for her for 60% of limb occlusion, which is going to be 107 as her personalized tourniquet pressure. So now I'm going to have her go through a couple of different exercises that we usually do. Typically, our protocol, like we talked about, was 30, so sets of 30 reps, 15, 15, and 15. And in between each of those, it's typically a 30-second rest. But for lack of, for sake of time, you don't really need to see her go through each and every, rep and set. So I'll kind of guide you through what she's doing. But this is a great way to start for somebody who would be has to abide by non-weight bearing status. This is a good way to really mimic those gains, or get the same gains that you would get for full weight bearing or using actual weight without violating weight bearing restrictions. So the first thing that I like to get people going with is a quad set. If it was for a total knee or any lower leg injury where that brain body connection might be a little bit disturbed for the brain body connection for the quad. So the first one I'm going to have her do, I'm going to start her blood flow restriction right now. And so it'll inflate to that 107 using that real-time Doppler. And then what Rachel's going to do is she's going to basically tighten her quad, basically squeezing that quad muscle, holding for about 3 seconds or so. And typically, this first set, they would go through 30 reps of that. Then once she hits 30, we're going to do a 30-second rest. So it basically just kind of depends, where you're at for the progression. But for, sake of time, that's good enough. So let's just say she did her 30. From there, I'm going to hit the pause. That'll basically keep the pressure the same. Her pressure it'll still maintain that, it's trying to maintain that 106, 107 range right now for that personalized tourniquet pressure for her while she's doing her rest. So that 30 seconds goes by, then it chimes, and then we go into the next set of, this next set would be 15, and then so on. So 30, 15, 15, 15. So you're doing 75 reps of each exercise. From here, the next one, so that's the chime. I'm gonna have her do a straight leg raise. So typically we wouldn't do something like this where, you know, you were going from, you know, it'd be the whole one exercise the whole time. So quad sets the whole time, or straight leg raises the whole time. But, you know, just to kind of give you a progression, you know, once that patient masters that quad set, then I usually bring them into a straight leg raise. So raising up like that, you know, making sure she's maintaining that good quad control to prevent that quad lag. So she's going to go through 15. Where are you at right now?
14.
14?
There's 15.
There's 15. So then once she hits her 15, we would do, you know, again, that 30-second rest break period. So, yeah, and like I said, it would be all one exercise. So she would go through 30, 15, 15, 15 of straight leg raises, or quad sets, or, you know, the next progression I like to go to, if somebody doesn't have weight bearing restrictions, would be a full, you know, a full normal good form squat. So doing a weight bearing exercise or a activity specific work, you know, exercise for that particular patient. Go ahead and, so that's the chime again after her 30-second rest break. So now Rachel's going to go through some good form squatting, basically to, you know, that would be the next phase in our progression if the patient went through their weight bearing precautions or didn't have any weight bearing precautions. Yep, so she's going to go through 15 of those.
11.
Good, so there's 15 there. So I would hit, you know, pause, or let's just say that was her fourth set. So her 30, 15, 15, last set of 15. Then we would hit deflate. The patients are in their deflate, and boy, do they feel it, that's for sure. That last set really usually challenges them, and you're going to want to go pretty much to, you're going to want to have them hit failure or severe fatigue on that once they hit that last set, or second to last set. So that's pretty much how our blood flow unit works.